This video contains information regarding Chapter 12, Family-Centered Practice. Family systems theory, it can sometimes be a challenge for clinicians. There are a wide variety of ethnic, cultural, and linguistic backgrounds that may be different from those of us providing services. There are differences in family structure and support system that clients have or may have. Poverty will be a big impact on the disability and how that affects their resources available to them. And also just the increase in the number of families that have parents or adults with disabilities that can impact our family-centered practice. When we look at a family systems perspective, I think it's important to have some guidelines that they provided for us, and they're good guidelines to follow. That the family as a whole is greater than the sum of its parts, and that one change in that family dynamic can greatly affect the entire family system. So that's key for us to remember. And that this family system exists within a larger society, a larger environment, a larger context. And that, of course, families are multi-generational. And so they have lots of different generations involved in that. So we need to take that into consideration. Certainly, we need to consider the cultural and social economic considerations. We talked in one chapter about cultural and diverse clients and assessment. This is cultural and diversity in terms of treatment and how we recognize those cultural differences and provide those services within that. Not only just culture in terms of ethnicity, but also cultural in terms of poverty, socioeconomic. Many times we focus a lot on the cultural aspects, and we don't always provide that diversity in respect to socioeconomic, which is certainly a factor many times with our clients. So when we're dealing with family-centered practice and communication disorders, we need to talk about effective communication. And I think that whether we're dealing with different cultures or ethnic groups, this is always good. That in our communication we have clarity, we are very concise or succinct, and that a sense of redundancy. That doesn't mean always saying the same thing, but maybe saying the same thing in a different way or to different family members helps. And always doing that with the greatest respect and being genuine with our clients and with our families. I think if we remember those things, we can really be great clinicians delivering family-centered practice.